Hi everyone, my name is Clark Foreman, and for this response, I want to reflect on the needs and challenges of disaster workers through the framework of the disaster phases discussed in the video, specifically the heroic phase, the honeymoon phase, and the disillusionment phase. I'll be approaching this from a counseling informed perspective using appropriate clinical language while also acknowledging the emotional, physical, relational, and spiritual realities disaster workers face across time. So, one of the most important themes that stood out to me in the video is the idea that disaster recovery is often misunderstood as a short term crisis, when in reality, it is a long term journey. That misunderstanding alone contributes to many of the challenges we see emerge for helpers, caregivers, and communities over time. So, the heroic phase is marked by high energy, urgency, and a strong sense of purpose. Disaster workers are often fueled by adrenaline and meaning. As the speaker in the video described, this phase can feel almost intoxicating. People are rescuing others, restoring order, and meeting immediate needs, often at a great personal cost. One of the primary needs during this phase is guidance around sustainability. The challenge is that many disaster workers do not yet recognize their own vulnerability. They often minimize their exhaustion, suppress emotional responses, and operate under the assumption that they can keep going indefinitely. This is especially true for individuals who see their work as a calling, such as church leaders, volunteers, and first responders. But from a clinical perspective, the denial presents during the heroic phase can be understood as a protective coping mechanism. It allows individuals to function in overwhelming circumstances. But however, when this denial is reinforced rather than gently challenged, it can contribute to burnout, vicarious trauma, and compassion fatigue later on. Emotionally, helpers may feel driven, focused, and emotionally compartmentalized. Physically, the body is often in a prolonged state of hyperarousal. Spiritually, the video highlighted increased openness to God during this phase. I found this is I found this especially significant because while spiritual sensitivity can be life giving, it can also unintentionally justify overextension if rest is not framed as necessary. As the heroic phase winds down, the honeymoon phase begins. This phase is often described as time of relief, gratitude, and optimism. On the surface, it may appear that people are doing better. However, the video emphasized that this phase often includes a crash point, which is one of the most critical and vulnerable moments in disaster recovery. The crash point tends to occur when adrenaline decreases and the nervous system finally has space to process what it has been doing. Disaster workers who were most active early on are often the most affected. This includes caregivers, ministry leaders, medical staff, and volunteers who neglected rest during the heroic phase. Physically, individuals may experience extreme fatigue, sleep disturbances, immune system issues, or symptoms that mimic cardiac events. Emotionally, grief, irritability, emotional flooding, or numbness may surface. The video's discussion of delayed physical illness and mortality following Hurricane Katrina highlights the powerful connection between chronic stress and physical health. From a trauma informed lens, this reflects what happens when the body has been in survival mode for way too long. Once safety increases, the nervous system attempts to recalibrate, sometimes abruptly. Older adults, children, and individuals with pre existing medical or mental conditions are particularly vulnerable during the phase. The disillusionment phase is often the most emotionally painful stage. This is when the long term reality of loss becomes clear. Resources diminish, external support decreases, and people begin to feel isolated or forgotten. For disaster workers, this phase can feel especially discouraging because the visible process slows while emotional needs intensify. During this phase, fear, anger, grief, and hopelessness often surface more fully. Clinically, this is where we may see the onset or worsening of post traumatic stress disorder, major depressive disorder, generalized anxiety disorder, substance use disorders, and increased risk of suicidal ideation and behavior. The video noted a significant rise in counseling utilization during this phase, which aligns with the research showing that trauma symptoms often emerge after the initial crisis has passed. The increase in domestic violence, addiction, and other maladaptive coping strategies discussed in the video can be understood through a systems lens. Families and communities under prolonged stress may revert to familiar but destructive coping mechanisms when resilience is depleted and support is limited. Effective treatment during the disillusionment phase must be long term, trauma informed, and collaborative. Evidence based approaches such as trauma focused cognitive behavioral therapy, EMDR, and psychological first aid are especially helpful. Psychoeducation is also essential, helping individuals understand that their reactions are normal responses to abnormal events can reduce shame and foster hope. Prevention and community based interventions play a crucial role as well. Suicide prevention training, peer support programs, and community debriefings can normalize trauma responses and equip individuals to support one another. The emphasis in the video on collaboration between churches, nonprofits, and mental health agencies highlights the importance of shared responsibility in recovery. From a counseling perspective, spiritual care must be integrated thoughtfully. Faith can provide meaning, comfort, and resilience, but it should never be used to bypass grief or minimize psychological pain. Instead, spiritual integration should make room for lament, doubt, and questions while offering hope grounded in presence rather than pressure. So, the reconstruction phase reminds us that recovery is not linear, it's not one size fits all, it is not from A to Z. Individuals and communities may experience progress in some areas while remaining deeply impacted in others. Healing often unfolds in waves rather than stages. This phase also highlights the importance of sustained presence. Churches and local organizations often have the greatest impact here because they are embedded in the community. Long-term recovery depends not on quick solutions, but on consistent care, relational connection, and continued access to mental health resources. Spiritually, individuals may begin wrestling with deeper theological questions about suffering, loss, and meaning. But when supported well, this phase can become a space for post traumatic growth and renewed purpose. So, overall, this video reinforced how critical it is to view disaster recovery as a holistic, long term process. Disaster workers are often praised for their strength and sacrifice, but their ongoing needs are frequently overlooked. Without proper support, the cost of helping can become overwhelming. Successful recovery involves more than rebuilding structures. It includes restoring emotional safety, relational connection, and a sense of meaning. The story shared in the video about the man who moved from addiction and trauma into healing and leadership is such a powerful example of post traumatic growth. It reminds us that with sustained support, education, and care, even the most devastating experiences can become places of transformation and renewal. So, I have included the following resources in the comments below, and I really appreciate you for taking the time to listen to my response. Thank you so much, and have a great